Bill and Kelly Show is recorded at Studio A at Executive Suite Squared in beautiful Hammond, Indiana. Now, here's Bill and Kelly. Good morning and welcome to the Bill and Kelly Show. Today we're very honored to have a guest come back on our show, and we're so happy he's able to join us today, Dr. Mario Mendoza. Mario, welcome back to our show.
Thank you so much, and good afternoon, and I'm really, honor is mine, and I'm so grateful that you have me on the show. Good to see you again.
It's great seeing you, and we've been kind of keeping track of you through your social media and some of the things that you've been doing. So for our new listeners and viewers, why don't you give us an idea who you are, where you came from, and what you're doing today?
All right, great. Well, Bill, I see that you have fantastic lighting, and I love the beard that you're sporting. I wish I could grow one like that, so I just want to say that off the bat. Firsthand. So
it's not easy, pal. I'm telling you. And one thing I found out, Kelly met me with the beard, okay? And in fact, I think it was during that period of time that I shaved it when you were on the show last. Mm-hmm. Life wasn't too good for me without a beard because, as she said, I never knew you without a beard. So it's kind of like, grow back the beard, buddy.
So I have to say, I did have a similar experience in the past, so I can understand with and without. But thanks again. I'm happy to be on it, especially with everything that's going on, and where do we start? But I'll give a little bit of my background. So I'm a clinical anesthesiologist, and last year in 2019 in July, I decided to quit my job. I wasn't any longer practicing. I was in the biotech industry. I was practicing before that. And so I quit my job because God really put it in my heart to finally give full focus to my nonprofit, LifeUndocumented.org. And so once I did that, I also started to do a little bit of consulting on the side in biotech that's slowly going during COVID-19. So I'm grateful for all that. And I mention all that because it's really all things that are seated deeply in my heart, all these initiatives. I ran across the border in 1981 when I was 7 years old, escaping death threats with my mom and my older brother from El Salvador. Back then, my mom was working on teachers' rights, and she was branded a communist, and the Salvadoran government was fighting communism, and so she was threatened to death. So we left within a month of that threat in 81. We applied for political asylum. I think that's something important to say, and we were denied, even though we were threatened by a political party, which meets criteria. And so it's important to mention that. So what's a mother to do? Imagine, leave her two boys in harm's way. So we ran across the border, and we are still here because of the 1986 Amnesty Act, and I got my green card that way. I'm grateful to God, first of all. I know I can do nothing on my own. Yes, I'm proactive about things, but I know God is who gives all and gives me all the energy to do everything. I have experienced that. So I wanted to share that. So I started LifeUndocumented.org, really came about early in 2016. And I made a 7-minute documentary. And since then, really its mission is to, through real world immigrant data and stories, to humanize the undocumented immigrant, to advocate for undocumented immigrants that were previously undocumented or currently undocumented. And why is that? We know that, one, the way the rhetoric is going about undocumented immigrants, even immigrants as a whole, so all-comer immigrants, has really deteriorated, right, to the level of subhuman, that they're criminals, that they're murderers, that they're here only to take from society, not to add anything to society, that they're not even human. So that's why the story aspect, to humanize the undocumented immigrant. And two, there's a lot of misinformation out there about immigrants as a whole, especially about undocumented immigrants, taxes, jobs, the impact on society. Now, I wish I didn't have to speak about a human's impact on society or on their adoptive country, meaning the United States. But the point is, and the fact is, that we are not at a level right now, at least in the United States or really globally, where we love other humans for the sake of being human. We don't. And so because of that, I'm taking a data approach so that we can have discussions based on data, showing the value that undocumented immigrants bring, their contributions on paper in collective data. These I will do through one-on-one interviews, and I hope to then, I already started working on that, as well as a study that I can't go into any detail now, but it'll be a study here in the United States to collect data like this, to publish it, and to speak to this so that it can defend our discussion instead of having false imaginings and misinformation.
That sounds absolutely amazing. So this is ongoing now. You are collecting data on folks that are here, what they're doing, and getting deep into analyzing their life.
Exactly. And one of those initiatives is a study that's going to be in, I hope to be, I'm in early stages of that, writing the study protocol with a medical student that's working with me, which I'm really grateful for, and actually two medical students. And I'll be reaching out to folks in the immigrant advocacy space to then run these interviews and ultimately then to publish data from these interviews, of course, de-identified. No individual will be identified, to speak to the impact of undocumented immigrants in the society. Again, I just want to repeat, this is not a value-based argument because I feel the need, because that's how I see humans. It's because of the current state of the United States, really current global state, and that they dehumanize undocumented immigrants, they devalue them. And I think part of the discussion needs to be based on numbers, not just an emotional discussion and a humanized, say, based discussion.
Now, it's obvious that you're so emotional and committed to this, you actually put aside a marvelous career as a physician to bring this word out, and that is something we've got to take our hats off to you for doing. Why don't you speak to us a bit about what are you finding? You know, as you begin delving into, I guess, the misinformation that is out there. You know, again, I think if you listen to the wrong channels, you know, there's a hate tag almost placed upon these undocumented people that are here. And you and I have talked about this before. It's totally unfortunate because they are a vital part of our society. You know, there's jobs that they're doing, they're supporting. And so why don't you speak to that a bit, and some of the misconceptions of what happens when someone does come here undocumented?
Absolutely. And I'll speak to perhaps what we're hearing more of in the media, to be quite frank, from different sources, right, including the current administration. Not so much from what's called the gray literature, which are organizations, policy papers, government institutions that tend to be neutral to supportive. I'll say, and here's the key. When they are neutral, they tend to present data on undocumented immigrant impact on local crime, on jobs, taxes, the types of employment that undocumented immigrants hold. And so they inadvertently or indirectly advocate for undocumented immigrants when they speak to this neutral data, and that is because the data shows the positive impact that undocumented immigrants have. So crime, for example, and by the way, just to backtrack a little, this data is based on US Census data. There is very little to no undocumented immigrant, what we call in medicine, real world immigrant data. So this doesn't exist right now. I want to create that. And that is based on one-on-one interviews. The data that's out there now is based on the US Census. And I'm not criticizing that data. I'm grateful for that data. It comes from large nonprofit that tend to be neutral organizations, not all that are neutral, but tend to be. And they put out data on taxes, employment, impact of undocumented immigrants, even healthcare insurance, but not necessarily healthcare utilization. For example, how many times do you see a doctor in any given year? How much money do you spend? Are you insured or not? Those are the arguments and advocacy that I will take on in my study as well. Part of those data points that I hope to collect and then publish to advocate for undocumented immigrant, for the undocumented immigrant. So going back to the things that you hear that undocumented immigrants are taking our quote unquote jobs. So that's untrue based on the U.S. Census. We know that undocumented immigrants, again, census data, most of them are in manual labor jobs, hospitality industry, and of course there are immigrants that are in professional jobs that maybe require college degrees or advanced degrees. We know that as well, but that's not the overwhelming majority. And so most folks that are in these jobs, acutely, there may be jobs that decrease because of that. But there's data showing that in the long term, overall, there's no impact on the availability of these jobs for other folks, meaning native born Americans that can still apply for these jobs. Two, taxes. Again, only an estimate, unfortunately. This is why we need this data. Exactly why. So about 50 to 60% of undocumented immigrants file for taxes based on a temporary ID or TIN, ID number. So you can do it that way. Again, just an estimate. Collectively, they put into the economy about $12 billion a year. That's based on 2016, 2018 data, so not the most recent data. Again, estimates. Now, let's put that in a framework of social benefits. Except for about 7 states that do provide healthcare and benefits for minors, not for adults that are undocumented, there are no social benefits for which undocumented immigrants are eligible. So let's do the quick math here. They put in $12 billion and take from very little to none in social benefits. So from an economic perspective, there's a surplus, right? There is an impact, a positive impact. Again, these are not the arguments I wish that I needed to have. I wish that we could love all humans for being human and love one another. Mark 12:31, love thy neighbor. But that is not possible, not in this country and not right now. This is not the current state that we're in. So we need to have these data-based arguments. The other is about criminality. Let's cover that really quickly. So the last data that I had my hands on from the US Census, again, up until about 2016, is that nonviolent crime in undocumented immigrants, or in areas where there's lots of undocumented immigrants, or an increase in this population, either stays the same or decreases the nonviolent crime. And the prevalence of nonviolent crime in undocumented immigrants is about 0.6%. For Americans that are born here, it's about 1.6%. So about 3-fold increase or a 70% decrease in nonviolent crime in undocumented immigrants. But in the media, what do you hear all the time? About the criminality, about the Remain in Mexico policy. Let's keep these folks across the border because of all the crime that's coming across. Well, that's not founded on any kind of reasonable or logical data. It's founded on racism, let's be honest, and false imaginings and fear, of course.
Well, I'll speak that. I think the last time we talked, or maybe it was in prep for the show, that was a big misconception. So what did I do? I went and looked at the FBI crime reports, which delve deep into demographics of the crime being committed. And ironically, that's what something I encourage everyone to do, is to look at the FBI report, which they're mandated to do at the end of the year, collect statistics on violent crime, thefts, home entry, that type of thing. And I saw very little having to do with undocumented individuals. Mostly it was citizens of the United States, and and actually, when it comes to violent crime, I think everyone needs to look at those figures again, because they will be shocked at who actually is committing the most violent crimes in the United States. But the percentage that they gave to undocumented individuals, very negligible. But what does make the media the most is a crime committed by someone, especially when we're talking about building border walls and trying to stop immigration. That seems to be a political jest, if you will, to try to make it seem like we're trying to stop crime, and actually we're spending more to stop something that's almost non-existent. So
absolutely, and thank you for bringing that up. I really appreciate that, and I think that's part of what we all need to do is to educate ourselves, educate others, and absolutely part of the core of Life Undocumented is to disseminate this type of education. Besides disseminating stories on undocumented immigrants, I am currently working, I feel blessed to be working with a filmmaker now on a second documentary. It will be full feature, and it will include undocumented immigrant stories, a lot from El Salvador and here in the United States in terms of some of that footage. My third documentary, which I've had planned for 2 years now, and we'll see what I can make that happen in the future, only through God, of course, is on the Northern Triangle. So El Salvador, Guatemala, and Honduras. And what's the point of it? It's really to highlight, among other things, why are folks fleeing these countries and why are they coming here, right? It's not because they want to buy a Mercedes and a big house. They're fleeing usually horrific situations by far. And again, that's kind of the point. We don't have this data. We know why people flee: domestic violence, gang violence, drug cartel kidnappings, threats, and violence. And then a certain percentage flee what's called due to economic immigration or economic migrants, meaning their life in their home country with the jobs that they can get, or maybe their unemployment, is just not feasible. They just can't even live. They simply can't live on those wages. And so they escape that as well. I can't say that that's the minority. It seems like it is based on, out of all those reasons for fleeing a country. Imagine, why would you leave your family behind? Why did we leave our entire family behind in 1981? Because we were threatened to death. My mother stayed for an extra month after she was threatened to death, exactly for that reason. She didn't want to leave her family. She didn't want to leave her career. She was a professor. Here, she cleaned houses for 28 years. And she did it happily, with joy, for her 2 boys.
Yeah, amazing story. Amazing story. And something that, we were talking about, it's interesting that we had planned this show a couple weeks ago. And of course, with recent events, I'd like to speak about that. The Supreme Court ruling that the DACA program cannot go away, or at least now. I mean, again, I think the current administration's opinion is this was an executive order and it can be easily stopped with another executive order. But the Supreme Court has challenged the administration, saying, no, you can't do that. Go back and try again, but you can't do it in the present form. So speak to that and talk about the original DACA program that was an executive order by President Obama, and talk about how that has affected people here currently.
Absolutely, and thank you for bringing that up. I definitely wanted to speak to that. And the first thing I'm going to say is, yay! Now it's not, as you know, Bill, it's not anything permanent. It is, quote unquote, you see in many articles, it's protected for now.
Right.
But let's not celebrate the present moment. Let's at least celebrate that. It's a very first step of the first rung of that ladder. So I was extremely happy to hear. I'm not currently in a DACA program. When we came over in 81, there was no such thing as a DACA program. So I see that as a step forward overall. That being said, I can appreciate, because we lived that way for 7 years, the anxiety and the stress that you live under in the shadows as a DACA student or as an undocumented immigrant, not being in DACA in 81 or now. So I am very happy that happened. It doesn't guarantee anything, though, and it doesn't mean that they're accepting new applications. So let's go into a little bit of numbers. DACA was started in 2012. Now, there's no transparency in terms of these numbers. There's not one source that I saw where there's correct numbers and they don't vary. They do vary. So what I've read and what I've seen is that DACA numbers currently are somewhere between 650,000 to 700,000. Some folks quote 800,000 currently in DACA. Total, I did see recently, since 2012, about 909,000 have received DACA at least once. So multiple times, it may be closer to the millions. So let's use about 800,000, which is the number you see that are currently in DACA without any new applications. So this Supreme Court decision, thank God, protects current DACA recipients, let's say about 700,000 to 800,000, from being deported, but there's no new applications being accepted. I didn't read any nuances about renewal either. I'm assuming they will allow renewal since they're not going to be deported. It's got to be one way or another. And then we'll see what happens in November this year with whatever next administration that we get. That will be key, as you know, the change or not there. But thank God for our judicial system, and I'm happy that it's in place and that it worked. I did want to make this point that's very, very important. So Life Undocumented advocates for all comer undocumented immigrants. Let's keep in mind that even though DACA is a great program, people in DACA, the dreamers, don't have a pathway to citizenship. It's like running towards the edge of a cliff. And so I know folks in DACA, and they effectively are anxious, stressed out, even when DACA is in place and not under attack like it is now, because they can't future plan, because they don't know what's going to happen, because there's no pathway to citizenship. It's like a road under construction that ends. And so that's the Dreamers Act. It's something that hopefully has been worked on, I know, for at least a couple of years. We'll see how that moves forward. I'm all for that. I am all for a pathway to citizenship for all undocumented immigrants. So let's put this into context. DACA is about 800,000, let's say about 1 million or 1.1 million total have come through that program, which I've read before. That's out of an estimated 11 million undocumented immigrants. So let's please keep that in mind. DACA is only 10% at best. That they are not representative of all undocumented immigrants. Neither does the legislation protect all undocumented immigrants. So even though this is a great step forward, it is not comprehensive or holistic in any way. And neither does it provide a pathway to citizenship. But I am happy that at least it's a Band-Aid so that folks that are in DACA now can breathe a little bit under the fear of deportation, which I've lived before as a child and as a teenager. So I know exactly what that feels like, even though I don't know exactly what they're feeling this very minute. I can't imagine that, but I have been there before as well. So I think moving forward, it's really pathway to citizenship, not based on merit, because how do you define that? The word merit is really just another word for racism in hiding. And so how do you choose who should be here and who shouldn't be here?
Yeah, one human side of this story that I'm sure you can appreciate. I was listening to NPR, and they were interviewing a participant in a DACA program who is working on their residency. And I'm sure you can appreciate that. You know, medical programs are one of the most grueling, and they take years off your life, if you could attest to.
Yes.
But, you know, to have this political discussion going on about removing the program and having to deal with the stress of going through your residency and then, you know, trying to get to where you're practicing is got to be a holistic feeling, you know, to try to go through a grueling program and find out you could be losing your ability to stay here is, you know, it's something that we should all pause and think about, because I mean, this person wanted to continue, and especially what's going on today with the pandemic, we need an abundance of medical staff. We need more doctors. We need more nurses. And so to turn people away or trying to get into that profession, to me, is just, we're not thinking. And
I agree. And if I could quickly maybe throw this out there in terms of more data. So of the approximate 800,000 folks currently in DACA, and I think I do know who that student is, by the way, and I'm happy to hear that student's vocalizing their story. I know exactly what that feels like, because when we were undocumented in the 80s, my brother didn't know if he could go to college every semester. He was blessed enough to go to college. And I didn't know if I could stay in high school or if I had to quit my going to high school and get a job to help my mom pay rent. That was a twice, 3 times a yearly discussion that I had with my mom. And so we always helped mom. We still do help mom, and we love to do that. We do it with full heart. But growing up, one of the first things that my brother did was he would get a $50 paycheck. He would take 35 of that and give it to mom right away to help pay for the rent. So I know exactly what that feels like, to have that uncertainty. I didn't have that uncertainty when I was a resident, so I think it's that much more stressful. But I did want to say, so about 27,000 of the 800,000, so 2 to 3% of the 800,000 are healthcare workers, including in that, I think it's about 2 to 300 are medical residents that are currently under DACA. Not everyone in DACA is a student. I think the overwhelming majority are students. And remember, you can't be in DACA if you came here older than 15 or 16 years old. I'm going to mess up which one of those numbers it is. And you are not in it if you're older than 31 or 32 years old. So again, a far cry from all undocumented immigrants that are protected under this program. And I know that folks don't like value-based arguments, but let's talk about that. DACA is exactly a value-based argument because you have to pay taxes, actually, if you're in DACA, and you are vetted. There's a background check. Mm-hmm. So it is a merit-based, value-based argument, the fact that you are already a DACA recipient. And the decision that was just made was based on a platform where let's not deport folks that are essential workers, which is a value and merit-based argument, not let's not deport them because they're human and we should love them. So I just wanted to throw that out there, that the current rhetoric is based on value and the impact that DACA students or DACA folks DACA recipients bring to the society.
Well, in this time and age, we cannot turn away help. Well, let me put it that way. It's foolish for us to do so. And well, let's go on to yet another topic, which today is Juneteenth, which is a celebration of, and people kind of get confused about this celebration. They don't look at the history. The emancipation was declared, and then 2 years later, the word still hadn't gotten to Texas, and I think there's a lot of things that still haven't gotten down to Texas, if you know what I mean. But without getting myself into too much trouble.
That'll be another show.
Yes. So Juneteenth was the actual, one of the Army officers went there and said, no, the emancipation has happened. You are now free. And so on this day, the word finally got to Texas that the slaves are free. So we're celebrating that today. That Kelly and I are going to take part in a march in support of that in Chester, Indiana. So, but again, with everything, the very troubling news out there, I wanted to bring that up today and discuss, because you've had some involvement with the protest, Black Lives Matters protest. Do you want to share with us a bit about that?
Absolutely, and of course, we all know what's currently happening, really globally, but especially in the United States, on a weekly basis. To put it quite honestly, I'm definitely not afraid to speak the truth. The Black community is being executed in broad daylight. Exactly what's happening. They are lynchings. The only thing that is missing is rope. Usually it's a bullet. But that being said, just in the past 3 weeks, there have been 4 people of color, 3 of whom were Black. One is a Hispanic man, that were found hanged on trees. So this is since May 31st. The last one, I believe, was June 16th or 17th. The first 2 were in California and the other in Texas, speaking of Texas. And the 2 in Texas, the names were not released. But it was a Hispanic man in Texas in the Houston area, and then and a Black teen in the Houston area. Again, they were preliminarily ruled suicides without any autopsy results to inform that announcement or that conclusion. So we are waiting for autopsy results. In addition to that, for at least one of those tree hangings, there is footage that has not been released. And that should hopefully then show what exactly happened, if this person committed suicide or not. And this does smell of wickedness. It doesn't seem like it's suicide, but we can't speculate. We do have to hold our emotion and wait to see what is happening. I have never experienced this since I've been in this country in 1981. I'm saddened to see, and it is painful in the heart. That within the context of Black Lives Matter and the Black Lives Matter movement, I am a part of a Facebook group that will have a blackout Tuesday, July 7th of this year. And I wait for their organizational cues. And I will absolutely be a part of, hopefully, their peaceful protesting. I am not for any kind of rioting. I don't think that you need to fight fire with fire. That is not the way. But the way is active, and the way are protests. And I think the majority, from what I see of the protests, are peaceful. It's just a few folks that are taking law into their own hands and destroying property. And there's, to me, no defense for that whatsoever. And it's just not the way. That is not the way you change the world. Even with the atrocities that are happening and the executions of the last man at the Wendy's with his back turned to the police, running away from them. Yes, he took their taser. Did he deserve to die with bullets to his back because of that? No. I saw that police officer is being charged, and I believe the last thing I read is that they may be facing the death penalty, actually. I am not necessarily pro-death penalty either, but I am for justice. I wouldn't say that the death penalty is a solution for any human being. I think justice, punishment, and therapy is a solution for human beings. But I did want to say about the Black Lives Matter movement, I was involved in a few protests, all very peaceful, all in New York. One of them was in the middle of rioting, actually. I was at a protest 10 minutes away, and the other was after that rioting a couple of weeks ago at Washington Square Park, where the Black Lives Matter movement showed up from Brooklyn, and it was very peaceful. I was there for about 4 hours near NYU, Washington Square Park, and I can tell you there were 0 instances of any violence, anger, or any kind of situation that necessitated police interference. The police allowed the protesters to march peacefully. They were protected by the police. And again, I'm not pro NYPD or pro police either. And I'm also not for fully defunding the police. I know the word defund, though, tends to connote taking away resources from the police currently in place and diverting and reallocating those to perhaps social services and schools. Completely on board with that. Many 911 calls should be a social worker, maybe alone showing up without police, or a social worker maybe with police backup. I am not for getting rid of the police department altogether. I think that's complete silliness. That is not the way we should go. But I'm all for completely revamping the culture of the current police departments nationwide, their brutality and the racism that exists in their thinking and in their behavior, and shooting someone in the back at a Wendy's when they are running away from you to death. So I've experienced this personally, where God had me, I think, walk out at the right time here in Jackson Heights. There was a man with schizophrenia that's Latino. I spoke to him in Spanish. He was in the middle of the intersection, and I calmly spoke to him, and I said in Spanish, "You may want to leave the intersection. Why are you here?" He said, "Because God is telling me to yell at people to wear their masks." I said, "Okay, I understand. You can keep yelling, but I'd rather you yell from the corner on the sidewalk and get off the street because you may get hit." Yeah. He immediately paid attention and walked away. So this does not need handcuffs or violence or getting him down to the ground. The police department showed up a little bit, NYPD. I stuck around and I told them, "Boys, he doesn't need handcuffs. He needs an antipsychotic, medical attention, and psychiatric medication." And he said, "No, we know him." And I said, "Please take care of him. Don't put handcuffs on him. That's not what he needs." And so they didn't do that. And I wouldn't give credit to myself, but I think that's one example of how we do need to take away funds from the police and then reallocate it to social workers that would show up to calls exactly like this.
Yeah, I do have to agree with you. Unfortunately, I think the rhetoric that exploded after the recent shootings was automatically defunding the police without unpackaging that and explaining why. Because in actuality, a lot of and some of my very best friends are law enforcement officials. We're about to have one on our show on Monday. Love him to death. But the thing is, with the rhetoric exploding and the media not helping, they don't delve deep into it. And law enforcement officials are being asked to do a lot, particularly when it comes into substance abuse, mental illness. and they will be the first ones to tell you, we've got enough to keep people safe. We need to hand this off to someone else. And that's what the discussion is all about. Give the social workers the work. Gladly, we want to hand that off to somebody. So we need to end up, just take a deep breath, step back, and have those conversations, because it's really what the police departments want to do as well. Mayor Lightfoot, especially, is the one that has been stepping up and have the highest regard for her, and has said, no, we are not going to defund law enforcement. We're going to revisit what they do and revisit their training, but it's not taking police officers off the street, because that is the last thing we need to do right now. But yeah, I'm glad you did bring that up. And one other caveat I do want to add to this, and a lot of people on the other side of the fence always argue, with this Black Lives movement, that, the times have changed. There are successful people, and and people of color, you've got to, just your career alone is amazing. But there are people that are trapped in lower income areas, and people don't understand, and they blame it on them. But they have to understand this. There are a lot of younger individuals, mostly black, and quite a few Hispanics as well, but that have been charged with a crime. And that crime was, in a lot of cases, totally unfounded, but it's on the record. And now, because it's on the record, they are now trapped into a lower income a area, and that is it kind of feeds on itself. And so that's something, a conversation that needs to happen as well when we talk about this, to understand why there's such a frustration in these communities. And other people know there are successful people. You just need to follow their lead. There are people that literally are chained, and they can't follow the lead because they have something to do with the record. And so that conversation needs to happen as well, and bring that out, and maybe looking at expunging some of these people that really want to just improve their lives, but they can't. Once you have something on your record, you just can't. And so there's that part of the conversation as well. But troubling times, my friend, troubling. And I'm hoping we can get out of this. And there's a day that both physically, where we don't have a pandemic to worry about. And before we leave, since you're a physician, if you don't mind me calling on your medical expertise, this is kind of troubling times as well, because of political conversation, people are saying you don't need to wear a mask. It's troublesome. Can you speak to that a little bit before you go, on your opinions as a physician about the COVID virus, and as we start opening up, how we should even take greater care on social distancing?
Absolutely, and I couldn't agree more. By the way, just as a quick side note, if that's okay, about what you just stated about a conversation, really what you're talking about is equity as opposed to equality. And so it's equity. We all do not start at the same starting line. Some people have 100-foot gain over others, right? Whatever that may be, economic, social environment, of course, network and social circles. And then not the least of which, parenting. What's the parenting and family structure? And so my mom cleaned houses here for 28 years, but she was a psychologist in El Salvador. And so I had that resource, which is all I needed. I didn't need cash. Well, we can all use a little bit of cash sometimes. Hot dogs don't buy themselves, New York City pretzels. But what I needed was a loving mom that was supportive, and that's what I've always had to this day. And so not everyone has that. And that's equity, the lack of equity. And then the other thing, we can go on this for hours, but I just wanted to quickly say, getting out of a cycle of poverty has its own psychology and trauma, which I'm not an expert in, I'm not equipped to speak on. But I can tell you, if I, quote unquote, got out of that cycle of poverty from the Bronx, where I grew up in New York, it wasn't on my own. It wasn't without God, and it wasn't without my mom's guidance. mom's guidance being a huge resource,
Mm-hmm.
part of the resource that anyone might have. And I grew up really mostly with mom. So I didn't have, say, a dad resource for most of my life at all. So most folks have that too, right? So that's what equity means. And people that are of low socioeconomic status that not only maybe don't have the most supportive family structure, but also the mentality, that cycle of poverty, that psychological cycle of getting out of poverty is extremely difficult, actually. So I don't give credit to myself. Thank you for your kind words. I really do give credit to God and the Holy Spirit and everything that He drives in me. I know that I can't without Him. I have experienced that. But going back to COVID-19, so I can fortunately and unfortunately speak to it personally. I did have COVID-19 for about 3 weeks. I had the most common symptoms of a mild case.
Mm-hmm.
What was published initially are the severe symptoms. And talking to my friends in the public health service in the DC area that I saw a lot of patients as well, that's shortness of breath, fever, maybe chest pain and pneumonia. That's more severe. That's when your oxygen levels are going down. You may be very close to getting a code blue and getting CPR performed on you, because that's how aggressive this virus has been. Folks in the field that I've spoken to told me that 1 minute someone has low oxygen levels, the next minute they can't breathe, they pass out and they're getting CPR. Going back to the mild symptoms that I had, which are very common, it's these: myalgia or muscle pain, muscle weakness, and these two I can't underestimate. You talk to most folks that had COVID-19 that was a mild case, it's really debilitating muscle weakness and muscle pain for weeks. I also had chills and fever, but not high-grade fever, but for multiple days, right? All this lasted at least 8-10 days in a row, but I was sick total for about 3 weeks. It took me another week to recover. So very aggressive, the sickest I've ever been. I self-cared at home, supportive therapy, meaning food, hydration, and rest. And that's all that I did. Some medications for headache and some muscle pain. That's about it. Simple stuff over the counter. I feel blessed that I survived it. I consider it every day a gift, because I could have gone, healthcare workers that are as young as 25 years old to 75 years old that have passed away from COVID-19, and dear ones and family members that unfortunately have been part of this tragedy of COVID-19 deaths. Going back to the mask, we all need to wear it. Why? A, it doesn't hurt. It could only help. That's the short answer. When you cough, just like when you have the influenza virus, you're spewing out of virus particles or the virus itself through your saliva, through your cough, coming from your lungs, from your mucosa, from your saliva, onto the air. It may last for a few seconds, gets on somebody else's skin, or very commonly what we call a fomite in medicine, which is just any object, fancy term. Somebody else touches it because it survives for a few hours, a few days. Now they're sick after they've rubbed their eyes, mouths, or nose. And that's how easily it can be transmitted, not just necessarily coughing directly. So wearing a mask limits it to minimal spread, if not zero. And if two people are together and they're both wearing a mask, or they're around one another and they're washing hands, then the chances of them getting COVID-19 or getting the coronavirus, I should say, COVID-19 is a disease itself, is minimal to almost none, right? Nothing is impossible, so I wouldn't say none. So very important to wear the mask. Here in Jackson Heights in Queens, which is one of the epicenters of COVID-19 and of the virus infection, people by far are wearing masks. I did want to say about, they say this from LifeUndocumented perspective. Keep in mind as we speak, migrants in U.S. detention centers currently about 28,000, down from 55,000 about a year ago, down from 38,000 in January, estimated, because these numbers are not transparent from ICE or Immigration Customs Enforcement, are in detention centers, not necessarily socially distancing. They're sitting ducks for COVID-19. We already know of one death. We know of pediatric cases, about 42 in Illinois, with kids in ORR, or Office of Refugee Resettlement, detention centers or baby jails, essentially, where these kids are at risk for COVID-19 and death, let's face it, where they're not socially distancing, poor medical treatment, if any at all, they're being ignored, frozen food, if any at all, cold floors, 50-degree temperature in these detention centers. ORR I can't speak to, but ICE, we know this happens. So really abusive, kind of torture technique environments, and they're at risk for COVID-19. And to add to that, the pediatric cases that have COVID-19, like those 42 in Illinois, are at risk for a pediatric inflammatory multisystemic syndrome, PIMS or PMIS, or Kawasaki-like syndrome, where you can get a lung clot and you can die from that. So have a twofold chance, or two chances, of dying because of COVID if you're a child that are seeing this, which normally is rare, Kawasaki disease, in kids that have had COVID. So migrants are particularly at risk, just like anyone else that's confined and not being cared for and not in isolation.
Yeah, that is a horrifying thought. These people that
Yes.
are trapped in these camps, and they have no other choice. And so, but yeah, I'm glad to hear you say that. I mean, if people are debating about masks here, and to the point, we've got to all agree that we need to protect each other to get out of this crisis, or else we'll be stuck here forever and ever and ever.
Yes.
So I will say we do have a Bill and Kelly Show mask that we could have gladly. In fact,
I would love to have one and probably wear it. And yeah, it would be a free shout out. I'm all for it.
you know what? That could protect you in many areas. I'm just saying. So.
And no, but Bill, as you nicely said, Mark 12:31, love thy neighbor. If nothing else, right? If you don't think you're spewing out virus when you cough because you think you're healthy, you maybe be early on asymptomatic with no symptoms. It's out of respect for others, for the potential of you getting sick and giving it to others, or you're healthy, you get it from someone else. You haven't had COVID-19, and now you give it to someone else. You're a vector, and you give it to someone that's at risk for death, someone that's elderly, over 65. Right. For influenza, we know the risk is over 65 and under 5 years of age for high risk complications of influenza. For COVID, what I've seen more is over 65 years of age. We're really all at risk, but there are people that are more vulnerable, like people with diabetes, with low immune systems that are immunosuppressed, people with heart problems, of course, any kind of respiratory problems, and the elderly that have dementia as well. So you can be a vector and give it to someone who is at risk for death from COVID-19. And that's called just a love for humanity, which is why you should wear your mask at minimum, to love others.
Right. And it's protect others and to slow, and eventually helping you by slowing it down. But yeah, we're always troubled when we go through the grocery stores and you get essential needs, and we're one of few people wearing masks, and they even have one-way aisles now. So, and people look at the one-way signs. No, just think of yourself at a street. You wouldn't want to go down a one-way street, but boy. Well, I pray and hope that's it. It comes to mind the sign that I periodically think of. It says, "You remember that love thy neighbor thing? I meant it."
Yes.
And what better times than now to think about that? It's yeah, definitely. Boy, we should probably start wrapping up though. And boy, I am telling you, is so happy to see you and see you look like you're doing great. So we're happy to hear you are over the COVID-19 and recovered great. And boy, and keep doing what you're doing. We need you to keep doing what you're doing.
It's so great to hear. It does matter. God works through your own spirit, but through others as well. And your words do matter. And I thank you for your supportive words and love, having me on the show. And hopefully this will make you laugh a little bit. I look great, but I'm actually wearing pajama bottoms. Well, I'm just kidding, but I could be.
It's a lot of people would be surprised when they're watching the evening news what's below that desk. A lot of times, especially during the summer, with the lights and all. I have quite a few friends that are on-air personalities. They've got Bermuda shorts on.
Bermuda shorts, right? They're PJs.
Exactly. So, listen, it's always an honor to talk to you and interact with you. And I tell you, it's been a pleasure. But we better start wrapping things up. If you'll hold on after we're done wrapping up the show, I'd like to have a few words before you go off. And folks, listen, we are wrapping up another busy week here at the Bill and Kelly Show. So please tune in next week. We're just a busy schedule. But Mario, thanks again, and have a great weekend. Stay safe out there, and we'll say goodbye for now.
Thank you so much, everyone. Thank you, Bill and Callie. Missed you this time. Next
Oh,
time.
yeah, she are heartbroken she couldn't be here.
I know.
Well, goodbye for now.
This episode of the Bill and Callie Show is brought to you by
Holy moly, look at this.
Shh, be quiet!
But this is important stuff.
Look, there's nothing more important than what I am doing right now, hitting Another Mystery by local author Susan L. Perry. I have already finished these, and I've ordered her newest book, The Proof is in the Pudding, on Amazon.
Really, you need to look at this.
Shut up!
Alrighty then.
Alrighty then. For these and other books by author Susan L. Perry, you may order them at Amazon.com or from your local bookstore. For more information about the author, visit her website at www.susanlperry.com.